I'm Cassidy.
And I'm Kennedy.
And this is Threads of Wealth.
The thing I love about H2 Tab is that it's so easy to travel with. It's so easy to take. Even if you're just going to work, you're going to a workout. If you're just on the go, it doesn't necessarily have to be on an airplane. But whether it's in a car, airplane, just going to work, it is so easy to take with you. The little hydrogen tablets are so small, they'll fit right in your purse. And then the same with the isotonics, which I take every single morning. They come in individual packets. And so it's so easy to just throw in your bag.
Yeah, I have to give a shout out to the new flavor, the lemon lime, because I just released and I tried it and it is so good. I like that it has like a lot. I feel like it has a lot of flavor to it. So everyone needs to try the lemon lime flavor and the raspberry and the unflavored. It's all good. But you can use our code Threads of Wealth for 10% off. Today we're talking about aesthetics, confidence, and aging well. Many women feel caught between wanting to take care of their appearance and guilty about investing in themselves. So where is the balance? Where do aesthetics fit into overall wellness, and what does it mean to age with grace? To explore these questions, we're joined by Brittany Wangsness, owner of Infinity Med Spa in Sioux Falls, South Dakota. Brittany works with women every day on confidence, self-care, and feeling their best. Welcome, Brittany, to Threads of Wealth. Brittany, thank you so much for being here with us today. I really wanted to just dive into first on overall what you do. But first off, when people hear the term med spa, they just think of beauty treatments. But you really see aesthetics closely combined with wellness. Can you explain why?
Yeah, I think they really honestly go hand in hand. When we think about how we feel about ourselves and how confidence works, when we feel beautiful and when we have features that we like or the things that we dislike are blurred and the things that we like are enhanced, we automatically have more confidence. And the result of that confidence then is a feeling of well-being. It's a feeling of wellness. And so I really do feel strongly that they go together for the women that I see. And I think it's important to understand that sometimes this industry can be a bit taboo, or, people want to use the back door. And I think we as women really need to embrace ourselves and that confidence. And I don't think we need to be afraid of it or we need to hide it.
Mm-hmm. Yeah, I think that's a great point. So you say how the industry can be a little bit taboo. So what's like the biggest misconception that you experience in your industry, in aesthetics, in just kind of like that version of the wellness space, whether that's people that refuse to come to you or people that are walking through your door for a consultation? What's like the biggest misconception?
Yeah, the biggest misconception is that aesthetics has to be abnormal or someone has to look abnormal, because we're all hyper aware of the person that we've seen on the street that has too prominent of cheekbones, too large lips, they look distorted or they look odd. And really that is just a minute fraction of the people out there seeking aesthetics. And so it gets a bad name, or, they'll say something about, oh, look at her bad Botox. Well, in most cases, it's bad dermal filler, but there's so much more to aesthetics than just Botox or dermal filler. There's laser treatments, there's light-based treatments, there's other skin treatments, there's hair removal, there's tattoo removal. There's so many other things that are important in the space. There's great skincare, there's facials. So people take that one little piece of things, they see that one abnormal person and they kind of put it all in the same box. Mm-hmm. They automatically think, well, the med aesthetic space or the med spa space is all abnormal. And that's just completely false.
Yeah. For the people that you see, what do you see change? And do you see people's confidence change after treatments with you? And then what do you think that confidence plays in our overall well-being?
Oh, for sure. I mean, when patients come to me, first of all, we're discussing something they're vulnerable about, right? Mm-hmm. So I'm sitting down with some empathy because I'm going to ask this person, why are you here? What is it in particular that brings you in? Do you maybe, and people often use descriptive words, I look sad, I look tired. People keep commenting about, do I have the, excuse my French, the resting bitch face, or, oh, you look grumpy all the time. You must be upset. That's usually how the conversation starts. And they typically don't know why. Like people are saying these things to me and I don't know why. And then it's my job to look at the face and say, okay, what is happening with your face as you age that is causing these features to come out, that sad look, that angry look, that tired look, and really getting into the anatomy of why that's happening and what's happening with their age and what we can do to correct it. And there's lots of things. It can be something incredibly minimally invasive, like a light laser treatment, or it could be as invasive as me recommending a referral for some plastic surgery. So it's really, it's all through the spectrum. So I think it's important to come in and do a consultation with somebody who really understands, I would say, the anatomy of aging and what is happening with your body.
Yeah. And I think for you specifically, we've had the pleasure of knowing you for a long time. And so I think that understanding is a huge part. And I want to back up just a little bit and give you an opportunity to share a little bit about your background and how you got to the point of opening Infinity Med Spa. You just celebrated an anniversary.
2 years.
Right? Yeah, that's awesome. So I want to hear a little bit more, or I want to give our listeners just kind of a better perspective on what you've done, where you've come from, and then what you've built, because I think that's a really cool story.
Yeah. Well, thank you. So I started off as a nurse and then went back to school to be a nurse practitioner. I have a wide, I guess, array of history in doing different things in nursing, all the way from ICU to ER and a bunch of things in between. And at some point I had the pleasure of working for a plastic surgeon. And that's kind of when I really fell in love with aesthetics and kind of seeing maybe what surgery can do and what aesthetics can do and how those two things can go together. And so after I graduated with my DNP, so I'm a doctor of nursing practice, I'm a nurse practitioner with a doctorate degree. After I graduated, I worked for an aesthetics only clinic for a period of time. I helped them with clinical education. I supervised a couple locations and a lot of people, and I kind of fell in love with education then too. And like all good things, there was just some things I was powerless to change at that practice. And I really wanted to be able to take care of people differently. And I wanted to be able to support a team of people differently. And so that's really how Infinity was born. I had a really some great friends, because I too had a lot of self-doubt. You know, here I was 40 years old. I had 3 little kids, a husband that maybe was or wasn't super supportive of things. And it was scary. And I took a great big leap of faith. I borrowed a whole bunch of money and I did this thing. And what I've created is a place I love to come to work every day, a culture where my team thrives, and a culture where I can help other women feel and look their best. And so Infinity it's about confidence. It's about a safe space. And I think really that's kind of the gist of it. That's what I really wanted for people and for myself. I wanted to come to work today at a place that I loved every day. I pull into the parking lot of my practice every day. I'm excited to be there. So
that's awesome.
And I want my patients to be excited to be there. And I think for the most part they are. And in 2 years, we've had tremendous growth. And I think that culture and that soft approach has that holistic kind of wellness and that whole person approach has really helped us grow.
Yeah. So we hear the phrase a lot, aging gracefully, right? And there's, we're all going to age, and it's a good thing to age. I don't think we need to look at it negatively, but we can also, you know, what you do in your practice, we can help people feel more confident as they age. So what does that look like as people are getting older? They come to you and they say, well, there's things about them that are, you know, as they're aging, they're just changing. And so I'm sure you're reinstilling that confidence in them as like, yes, you're getting older, but also I can help you in some of these areas. So what does that phrase really mean to you?
Yeah. So aging gracefully gets to mean what you want it to mean. So, and it's individual to each person. Aging gracefully to me might mean something different than it might mean to you. And so really it's taking a deep dive into the psychology of that and what that patient really wants and what they're seeing, and then how I can help them, I think is the biggest thing. So it can be what you want it to be. And my job is to give you an assessment and provide you options.
Yeah, that's awesome. Is there ever a point where somebody comes to you, and Cassidy kind of hit on it too, but they are just completely fed up? They've waited a long time to invest in themselves, that they always put themselves on a back burner. You see that a lot with moms. You see that a lot just with, you know, working moms, especially, that they wait a long time to finally care for themselves and invest in themselves. And then they just want to like dive headfirst into change this. Do you ever sit down with somebody and kind of exactly like Cass just said, like, okay, let's back up. you're great. I want to help you, but in a more natural way.
Absolutely. I think, yeah. I always use the term like the best injectable is undetectable. And it's important to start with something. It's not important to start with everything. So I think for my patients in general, we try to come up with the top 3 things. What are the top 3 things that really bother you? And what are the solutions to kind of correct those or enhance those or make those better? And I think we really try to take it and put it into digestible bites. And trust me, I see people with body dysmorphia. I'm pretty good at identifying it at this point. It goes, that consultation goes sideways really quickly in general. And I'm good at, you know, kind of pulling those people back too. And we have to make it work in terms of your timing, because some of the things that we do have downtime. We have to make it work in terms of finances. We got to make it work in terms of social events. There's a lot of things that come into play. But yeah, sometimes I have somebody come in and they're like, I just want it all. That's not the case most of the time, but what we try to do is really create a treatment plan for them that makes sense, because sometimes as we sort of enhance one feature or correct something or take away the brown spots or whatever it is, make you look less tired, that plan might change. And so we need to know that that's fluid. And so I might keep a list of the top 10 things you told me, but really for the patient, I like to just break it down into 3. And then as we check something off the list, we add something to it. But I mean, I have the luxury. I also work for Allergan Medical Aesthetics, which is the company that makes Botox and Juvederm. So I actually teach and train for them. That's a part that I missed. So I have the luxury of being in med spas and being in spaces all over the country. So I get to see there are different looks in different parts of the country.
It's true.
I went to Dallas and I came back and I was like, my lips and my hair are not big enough to be in Dallas. You know, if you go to the certain parts of California, you kind of see different things. And really what we want to do is a Midwest style of aesthetics, which is really basic. It's really natural. It's really digestible. It's one thing at a time. And it's more about confidence. We in the Midwest are slow to the party. We have neglected ourselves way more than some of our counterparts in different parts of the country. So it just wasn't accessible. And now as it becomes accessible, it's what is the balance, you know?
Yeah, that's great. Yeah. And you guys have done, I've gone to your clinic a few times, and you guys do such a good job of informing, because a lot of times, like you said, people come in and they're like, I don't like this. This is what I don't like about how I look. And you guys do a great job of really informing on, because most people go in, I'm sure, and don't even really realize what they want. And so there's a lot of options, and but you can cater to really anyone, which is cool.
And that's the wellness piece of it, right? So that it's individualizing that treatment plan to each person. It's deciding what's going to work best for them with their budget and their time, and what's going to give them maybe the biggest bang for their buck too, depending on things. And so I think anything we can do to feel better about ourselves. And it doesn't have to be, we're not talking about vanity. We're talking about how we feel about ourselves on the inside. We were talking before we started this podcast today about how sometimes with the mom guilt, we're quick to do everything for everybody else, right? And we're kind of last, like you were saying. And so my message to women is it's okay to want to look and feel your best. And that's part of wellness. That's part of confidence. That's part of that mental health piece that I think we miss.
Yeah. Do you think that society as a whole kind of tends to naturally send different messages to men and women about taking care of themselves? Or why is there such a big discrepancy? Obviously, I think there can be the argument of like women just do more, women get their nails done, women get their hair done, like all this stuff. But I think that women can put themselves into that mindset that that's why, and that we really should just look at it as, no, we're just taking care of ourselves. We're just helping us feel like the best version of themselves. So how do you see that in your industry, that there's kind of just a different level of, I don't know if you can really call it acceptance, but just a different level of that self-care for men and women?
Yeah, I think, for me, what I've really reflected on is kind of the societal shift, right? So if we look at the housewife of the 50s, 60s, 70s, and even 80s, we had a lot of stay-at-home moms. We had a lot of women that, didn't work, relied on their husband for income. And so some of these things, obviously weren't around or weren't accessible, but it just wasn't as common for women to do things for themselves. Now, I think there's a statistic like 78% of women in South Dakota, and I might be wrong about this, so don't put me in it, work outside the home at least part-time. Okay, so now we're doing it all. Okay, we're raising our family, we're taking care of our kids, we're managing the sports schedule, we're getting all the groceries, we're working, we're directly contributing to our family's financial success. We're basically kind of doing it all, and yet we're still looked at as, you know, if we do something for ourselves, we have that mom guilt or that guilt, I shouldn't have done that, I shouldn't have spent that money on it. But then society kind of wants to look at us as like excessive. And I kind of want to flip the script on that a little bit, because I think we're doing so much for our families and so much for everything. Why don't we deserve to feel good about ourselves and to be able to splurge on the things that we want if it's financially reasonable for your family?
Yeah. Exactly.
So
and then there's the kids, like, you know, you mentioned it earlier, but like you feel like moms feel like they need to spend that money on their kids or this and that, but also moms have been, you know, you go through a lot in not only like pregnancy and giving birth, but just like raising kids, and you absolutely deserve that to take care of yourself too.
Yeah. And I think just to hit off of that I feel like I'm a better mom when I'm taking care of myself. So it's not, I think we need to, like you said, flip the script. I think we need to have a mindset shift that I'm not being selfish. I'm investing in myself so I can give more to my kids, so I can give more to my family or my business or whatever that looks like. I think has been something that I've struggled with, that like, I don't deserve that because this or that. I think it's, I want to become the best version of myself so that I can be better for them.
And we're not talking about vanity. We're talking about just, I feel better when I don't have wrinkles on my forehead. I'm sorry. I'm going to say that. I feel when I look in the mirror, that makes me more confident. That makes my mental health better. And I think that's okay.
Yeah.
It's okay to say
100%.
that.
Yeah. Can you just touch on some of some of the different services and products that you offer in your med spa?
Yeah, I mean, obviously, probably the most common product would be Botox, and sometimes Botox cosmetic gets a bad name. But the reality of it is there are 6,000 published studies on Botox. It's actually one of the most studied drugs on the planet. And there are 15 or maybe 16 now medical indications for Botox outside of the cosmetic use. So sometimes we look at that drug as just this is just a cosmetic thing. This is for vanity, but they treat bladders, they treat headaches, they treat children with cerebral palsy who have spastic muscles. They do so much more with that product. So it's such a useful, powerful tool. And when we look at, sometimes people say, well, how much are we using? And when we look at what we use with aesthetics, with cosmetic use of Botox versus what they use in medical use, it's a fraction. So I want to say that. So Botox is probably the most common thing that we do because it does smooth lines and wrinkles. And sometimes people will ask me, they'll say, I'm going to wait till I'm 40 to get Botox. And honestly, what we're doing is we're stopping the receptor that causes the muscle to fire. And when the muscle can't crease the skin in the same spot over and over again, basically the wrinkle doesn't form or it relaxes and the crease goes away, right? So I find Botox very preventative.
Yeah.
Like when I look at somebody and they're like, well, I don't have crow's feet. I'm like, let's put just a little bit there because you won't get them. You won't get the crow's feet or, and I think we're all guilty of this. I don't know. I look at my mom sometimes and I'm like, ooh, that's where this is going. I'm like, ooh, look at those crow's feet. I should definitely put a little Botox there. And I'm going to prevent this from happening. Maybe, maybe not. So Botox, we do a lot of laser. And so laser is so great on so many levels because it's about skin health and skin wellness, right? It's about reversing damage that you got even as a child. It's about keeping the skin healthy. It's about creating collagen and elastin production. It's about taking brown spots away. It's about helping redness. We actually treat a lot of rosacea with our different laser services. And sometimes people don't want to be on a prescription all the time. And this is another solution to that. Melasma comes out a lot in pregnancy or cloasma. People get kind of a dark marbly texture to the forehead, to the cheeks, to the upper lip. Looks like you have kind of dirt on your upper lip. That's another thing that we treat. So I would say probably the top things would probably be some Botox to smooth lines and wrinkles and laser. But also we do a little bit of dermal filler because another thing that I think is interesting is men age in a very linear fashion. They get a little bit older each year. Women actually have multiple periods in their life where they bulk age. So sometimes patients will come to me and they'll say, this happened overnight. I don't know what happened. My face just fell. And I'm like, it did.
It actually does do that.
That's actually a thing. Wow. So that's interesting too. But so sometimes volume loss in the face. you treating that with a dermal filler, or now biostimulants are huge. So they basically stimulate collagen and elastin production, things like Radiesse and Sculptra. So sometimes people will be adverse to a traditional dermal filler, but we can do something really great with a biostimulant. We're going to see more of those enter the space, I think, in the next few years for sure. Laser hair removal. I'm sorry, as a mom, that's probably one of the best things I've done for myself. To not take the time to shave and have to worry about it. I can just go right to the pool with my kids. Even tattoo removal. I think we have a lot of patients that got tattoos when they were younger that, you know, don't necessarily love them anymore. What else? We do some medical weight loss. That jumps into the wellness space too. We're kind of picky about it in my practice and who gets it and who doesn't and how we do it. But I think especially for perimenopausal women, there's definitely a shift in your ability to use insulin effectively and people have some insulin resistance, and that 5 pounds turns into 10, turns into 15, turns into 20. So how do we stop that from happening? You know, not only for your mental health, but also for your general well-being, for your blood pressure, for all the different things. What else do? We do some cool sculpting, which is kind of fun for areas that, I mean, I had 3 C-sections. I'm a mom. I have a pocket on my lower abdomen that no matter how much I work out, I can't get rid of, but cool sculpting helped me with that. I think that's kind of it. I think I touched on most things.
What is cool sculpting? I don't know much about that.
So cool sculpting is cryolipolysis. It's actually freezing your fat cells. So there's a specific size applicator depending on the little fat pocket.
Okay.
We put it on the area, we'll just say the abdomen for reference, put it on the abdomen. It's able to kind of suction that skin up between 2 chiller plates. It chills the skin and the tissue to a certain point where it causes apoptosis. The fat cell actually bursts and then it drains through your lymphatic system. And I would say like 4 to 12 weeks. And it just reduces the amount of fat in that area. So I know women out there are going to understand me. You get this bulge from the C-section and it's kind of weird and awkward and your pants fit funny. It's really great to put that applicator on there and just reduce that. And it's really about how you feel in your pants more than anything.
That is neat. I had no idea that was.
So yeah,
is it like immediate? Like how long does it take to see results?
It takes a little time to see results.
Okay.
Yep. So like I would say most people by 6 weeks notice something, but it can take up to 3 months.
Okay.
But you know, you go right back to work. There's no pain with it. It feels kind of like you stick your hand in a snowbank and it gets really, really cold and it hurts for a minute and then it goes numb and you sit and my patients sit and watch Netflix.
Oh wow.
How long
or read a book. Like 45 minutes.
Oh wow. That's
so it's kind of cool.
The Botox was really informative. Just knowing that like it's such a lesser dose, right? Than like people would think probably. And I think that in like the wellness, the very crunchy side, that'd probably be the biggest critique.
Yeah.
But here, the thing about what we talk about on our podcast here is balance, right? And like both of us will never say that we do everything like perfectly or not. And so people on the way crunchy side of the aisle will say, you know, that Botox is not that. But for one, knowing that like such a minimal dose of what you guys do, and two, that there's balance, right? We need balance.
Yeah. And for me, I struggle with TMJ. I've seen you before for Botox on my masseters, and I need to come in again because I have a headache right now. However, I think like from that, I think that would, correct me if I'm wrong, be considered more of the medical side. And so it's more than the aesthetics.
It's more than
that. For me, it's, do I live in constant pain? Do I not sleep at night? Do I, wake up? Do I have headaches every single minute of the day because I can't stop clenching my jaw? Or do I go get Botox and do something that's actually helping? And I know TMJ can cause a lot of other issues as well. And so I think another misconception is that just because you're like, well, Botox can help TMJ, or like, oh, okay, well, I'm more natural, so I don't do Botox.
Okay, but I think botulinum toxin A. It's like one of the most natural substances ever.
See, that's
botulism.
That's the thing. I think it's just people like
that's a misconception. Like, that's really good to know.
It is good to know, and I think that's what people just hear Botox, and then like red flags go up, and they like turn the other cheek and are like, don't talk to me about it. And I think it's so important to be informed. Like, educate yourself. If you have questions about something, don't just follow along with it because it's a trend or it's because that's what my crunchy neighbor is doing. Like, actually ask questions and then decide if it's right for you.
Well, and come and see a professional too, because I feel like what you read on the internet, there is so many misconceptions, and you would be shocked, you guys, the number of patients I treat who for cosmetic Botox who come in and then go, oh, I knew it was time to come back because my headaches are back. So, you know, I have the eye strain or whatever. Like I noticed that, I'm just having terrible headaches. And so I knew it was time for my Botox. So although we're treating lines and wrinkles and we love the cosmetic benefit of it, if I'm taking your headaches away too, that's pretty spectacular. Just last Friday, I saw a patient for Bell's palsy, which is a neuromuscular condition that causes drooping in the face. And we're able to correct some of the asymmetry that's happening with some well-placed Botox. I saw another patient for trigeminal neuralgia who's having some significant pain, and we're able to use Botox for that. So there's other outside of just the cosmetic use. Even in my clinic, we do other things with Botox. You know, tight neck muscles, trap muscles, like you said, treating headaches. This is kind of funny, but I had a patient. I actually treated her butt. She had a back surgery, and your piriformis muscle is what causes sciatic nerve pain. And her piriformis was so tight, like she wasn't sleeping. She was just absolutely completely miserable. And we were able to isolate that and put some Botox in there. And it helped a lot. I laughed because she was like, "Do you think you can do this?" And I was like, "Well, I'll try."
I'll try it.
And it worked great. So, I mean, just, I guess, definitely if you can feel however you want to feel about it, but there's a lot of benefits to it too. Absolutely. And just seek a professional before you get wrapped up in kind of what's going on online.
Yeah, exactly. Sure.
I think it's been FDA approved now for 25 years too. So if it was really hurting people, we would have heard about it.
So can you also talk a little bit about your dermal filler? Because I think, and I'm not even going to attempt to know what's in it because I'll botch it, but it's a more like what you use specifically is more natural, right?
Well, so dermal filler in general, I use the Allergan portfolio of products, which is the Juvederm collection of filler. And it's a hyaluronic acid. So it's synthetic hyaluronic acid, but you naturally have hyaluronic acid occurring in your body. So this is a synthetic version of it. But what is happening as we age in particular, so I like to tell people, think of the human face, the fat pads and the muscles like the table and the skin like the tablecloth. As we age, we get bone resorption as women, primarily in our temples and in the back of our jaw, and then in our lateral zygoma out in our cheeks. We lose fat in our forehead, in our mid-face, under our nose, in our chin. And we also get some muscle atrophy as we age. So it's like the table is shrinking, but the tablecloth is staying the same size. So how that skin drapes over the bone structure, how that tablecloth drapes over the table changes. So explaining the anatomy of that is really important to the patient, and where we need to strategically place filler to restore that natural volume and restore that natural shape, face shape back. I consider it like ligament lifting, because a lot of times when I'm placing it, I'm putting it strategically like under a ligament or around a ligament to re-augment that ligament that has loosened up and caused some sagging. It's more about facial balancing. It's restoring areas that are losing volume strategically than giving somebody big cheeks or giving somebody big lips. It's about really looking at the anatomy of the face. So back to your question. So we use hyaluronic acid. The products that I use all have different rheological properties. So they're all made slightly different. The molecule size is different. The molecular weight is different. The affinity to water, how much water they like or do not like, how firm they are. There's so many different things that goes into choosing the correct product. And when you choose the correct product, you put it in the correct place, it is so natural and so beautiful. I'll use this as an example. I would never use a product that I was going to put in a cheekbone or a temple or a jawline in your lips. It doesn't work. It's firm, it's stiff, it looks weird, it's unnatural. And that's where we get some of the bad outcomes in aesthetics, is we have injectors or clinical practitioners who don't understand facial anatomy and aging, and also the rheological property of filler and what plane of tissue and where it should actually go and be in the face. I hope that answered your question. So, but then back up. So we've got the hyaluronic acids that we use for structure, to restore volume that might be lost through weight loss, through age, whatever else is going on. And then we have biostimulants. So biostimulants are more for the skin. So they're stimulating that collagen production. They're restoring volume a little bit differently. They're never going to give you the volume that a traditional hyaluronic acid is going to give you. They just can't. But they can also, over a period of time, really soften, smooth, and enhance things. Soften lines, improve texture, help with pore size. So we kind of have two different kind of product lines right now in the US that we use primarily. Well, go ahead.
I was just gonna say, that's my personal story was with filler, because I remember I even texted you a picture of my and my lips are so like my top lip is so uneven. Whereas like I would look in, Zoom call or something. For some reason, I could really tell in the Zoom call. But like one side of my lip was like way saggier, like it just sat way farther down than the other side of my lip. And I was like, I went to you and I was like, I don't want like huge lips. I just want to have like normal proportioned lips. And I think that terminology with filler is like, oh, you're gonna have huge lips. And so that's just my testimony is like, the confidence that came with not absolutely hating or seeing that every time I look in the mirror of how uneven my lips were, you got that confidence back of just not having to think about that every time you saw yourself.
And that improves your confidence. It improves your how you feel about yourself, your overall wellness, your mental health.
Exactly.
That's actually funny you said that because it's actually called the Zoom effect, and that became really prominent during COVID because no one was working and everyone was working virtually, and people became very hyper aware of what their faces look like on Zoom because they could see it on you. Like, what is going on with my lip? Oh wait, I've always looked that way. I just didn't
notice it.
Didn't notice it.
Yeah.
And now we're just much more aware of it.
Yeah.
So
and we're just so hard.
funny.
I did that same exact thing on Zoom yesterday. I just like, you're in the conversation, but also you're like looking at the top corner of the screen, like yourself. And then you're like,
going on
okay,
there?
tuck in the chin, like
Lift up.
I know you notice it sometimes
like,
for some reason.
pay attention.
Yeah, and that's a great point, Cassidy, too. I mean, it's not unnatural. Like what we gave you is just a beautiful symmetric lip that you love to put lip gloss on and you feel confident about. You don't have a big lip, you don't have a disproportionate lip. No one would probably ever even know you had it done. Yeah. But yet we don't talk about it. The one thing too I'll say with women, so women as we age, we lose volume in our temples. Temples are something people don't treat enough, but temple volume. And then I joke women turn into Muppets. So we lose the fat pad under our nose. And as a result, the lip, basically the space between our nostril and the top of our lip elongates and they fall in, they evert. And so again, there's some really interesting things that happen with anatomy. And what I want to say is like, it's okay that happens and it's not wrong to want to improve that.
Right.
Yeah.
Like it's okay.
Absolutely.
Like it's actually happening. People come in, I think I'm crazy. Something's going on with my lip. I'm like, no, you're not crazy. It's actually happening.
It's happening. Yeah.
It's happening. And here's what we can do.
Yeah. So if a woman is struggling with trying to step over that line of feeling guilty or like having the courage or just really just investing in themselves, but they're not ready to fully jump in and they're not ready quite yet, but they want to learn more. Do you offer consultations? What's your like protocol for that type of a situation?
So we typically do free consultations and we just go through everything kind of start to finish. And in a patient like you're describing, sometimes it can be as simple as a great diamond glow facial or maybe like a light biostimulator peel and some great skincare. You would be surprised how much a medical grade skincare will really improve how people feel about themselves. And that's sort of a nice way to segue into other treatments if they're wanting to. Yeah. But if you choose to stay in that box of, I just want to do facials and great skincare, great. Like there's no pressure to progress, I guess is what I want to say.
Yeah, that's great. I love that you offer that because I think I personally I've done things before. I've done treatments before, but you still just are like, oh, I don't know. And we're not the professionals, so we're not supposed to know what's best either. But I think it's just, we expect that from ourselves and we expect it to be minimal. Whereas, we might be needing something that's not even on our radar. And so I think that's great.
I'm sure you have people that come in and are intimidated by the treatments. Do you have tips, recommendations for people like that?
Yeah, I mean, I think, again, it's important to start with something. It's not important to start with everything. And the hardest part is getting in the chair that first time. And then I believe truly that once you get to know us and kind of understand our philosophy and how we treat people, we do a really comprehensive consultation. We kind of go through everything the first time we see you, just to give you kind of all your options, because I think being informed is very important and being educated. And then it's up to you to choose, what is going to be best for you.
Yeah.
And so my big message, you guys, is just, we as women need to do more for ourselves. We need to not feel guilty about it. I think our spouses are quick to go out and easily spend money on themselves and not think twice. And we overthink everything. And I think, getting your nails done, getting a facial once a quarter, investing in a little bit of Botox if you don't like your frown lines, using Latisse to enhance your eyelashes, whatever it is, it shouldn't be taboo, and it shouldn't be, we shouldn't have to feel guilty about it in this day and age.
Yeah. One more thing I want to touch on before we kind of wrap up is you mentioned earlier that something you offer is the medical weight loss. And it's something that I was, I thought it'd be great to talk about at some point, because I think that there's, we can overuse it in our country. And I think a lot of people do and believe that, take it maybe for the wrong reasons as a quick approach. But I also am a firm believer in like helping. That is a good place or a good thing for people to jumpstart, weight loss.
Yeah.
And to really help them on that journey. So can you just speak to that a little bit more and like different situations that you use it for?
Yeah, absolutely. So I think, first of all, when medical weight loss in our practice started in kind of a funny way, because one of my partners joined me and she was already doing medical weight loss. And I was like, oh, I'm never going to do that. I don't think I want to. I don't know that it belongs in aesthetics. I don't know that I'm the right person to be facilitating this. And as it turns out, she went on maternity leave. So guess what?
You didn't have to. There you go.
I had to start, I had to learn. So I went ahead and I took a couple courses and I spent a bunch of time with her and started diving into what it was doing for people, the science behind it, how they worked, the physiology of it. And really what I realized really quickly was the mental health piece of it was huge, because most of the women that were coming to us were not morbidly obese, and wouldn't qualify for this drug through a traditional method through their primary care provider. However, they were the classic women who had gained 10 pounds after one baby, 10 pounds after another baby, another 20 pounds after the third baby. And all of a sudden they found themselves in a really uncomfortable position. And they're doing all the things. I mean, I've met so many women who are literally tracking macros and working out 3 days a week and, doing everything they can. And that weight is just sort of stuck. And that's where I really had to change my mindset is, maybe you only have 20 pounds to lose, but 20 pounds now is 30 pounds in 2 years. It's 40 pounds. And so I guess, how do I want to say this? The improvement in mental health in women and overall well-being and confidence that I've seen with medical weight loss is remarkable, probably even more so than what I do in aesthetics.
Wow.
And I also realized very quickly, because I'm anal, we're really picky about things. You have to come to my clinic, you have to have lab work done. We need to clear you for, a bunch of different conditions. We look at your thyroid, we look at your liver, we look at your pancreas, we look at your general electrolytes, we make sure you're not anemic, all those things. We screen you for a ton of things. We make sure you totally understand what the drug can and cannot do for you and what the process looks like before we start someone. And then we see our patients weekly for at least 4 weeks, and then sometimes every 2 weeks, and then monthly, because it also comes with some accountability, right? I need you to be doing the things that are important to keep you healthy. You need to take certain supplements. You need to be drinking enough water. You need to be resistance training 2 to 3 days a week. I need you walking. If you're having side effects, I need to know about it. But I probably have seen the biggest impact on overall mental health and well-being and confidence with the medical weight loss, which I think is remarkable, coming from someone who was very, I don't want to say against it. I was against it, and this is naive of me. I was uneducated when I started it.
Yeah. And, I really feel like, even though I don't think a lot of people that take it are morbidly obese, like you said, but I honestly feel like people that struggle with weight loss in this country are victims to a certain extent because of the fact, not everybody, I'm going to be careful with that because there's like discipline that goes into that, but also our country's filled with toxins, external toxins in our environment and our food, and that affects our hormones and that affects weight loss. And so as you're going into that journey of discovering that, I think that this is a tool to help you kind of kickstart that weight loss as you're realizing, what those toxins are and how to avoid them.
I would agree with that. And that's why we spend so much time with our patients on nutrition and really fitness counseling, because that's a huge piece of it. And I will say that we need to use this medication as a tool to jumpstart the rest of our life. Right. So we need to this is your chance to get your food in order and make sure you're eating enough whole food. And you would be surprised. I think the most shocking thing to me is the number of women who are under eating. They're doing all kinds of cardio. They're completely under eating. And when we really have them track what they're eating, I'm like, your body is starving. The reason you're not losing weight is because you're starving yourself.
Exactly.
You're just storing everything as fat because your body's like, I don't know when she's going to feed me again. So that's why even on these medications, it's super important that we keep your calories at a certain level, at a healthy level, to do that. But yeah, it's truly remarkable. And it's a tool because you need to be making those necessary lifestyle changes while you're on the medication. And then we have a very strategic way we transition people off. And there's a subset of people that will stay on. I don't think we fully, truly understand maybe the half-life of this medication too, because I now have patients, because we're treating people outside of the traditional, maybe, obviously the recommended dosing and things like that. But the patients that stay on a microdose for just the metabolic benefit.
Oh, sure.
I've had several patients that have had pretty significant autoimmune or immune issues that lost their weight, went off, and realized that they feel so much better with a small dose, like their RA or, whatever it is that they have, even like their Crohn's and things like that is better on a small dose of it. So I think it also does more than we think. And so I don't want to put that necessarily in a box because everyone is different with it too.
I think that also helps prove an important point that I think a lot of people miss in the wellness space is that anything worth doing will take time. So whether you're talking about these weight loss medications, whether you're talking about aesthetics, whether you're taking it back and looking at your workout routine, exercising, anything that you can do to invest in your overall health and wellness is going to take time. And so I think that's probably also another misconception that you probably see in the aesthetic space is I want to come to one appointment and I want to leave looking exactly how I'm thinking in my head. And if you're trying to approach it, one, that's probably not possible. Two, if you're approaching it from a longevity perspective and an overall well-being perspective, that's just not how things work. And so I think that that's something that we also have to keep in the back of our minds as busy women, especially, is that if I'm going to do this, I'm going to make sure that it's going to continue to be a priority. I'm not just going to make an hour of free time 2 weeks from now, that I'm going to continue to invest in myself to make sure that I am handling it in the best way possible.
And too, with the medical weight loss piece of it, I like my patients to lose 1 pound a week, maybe 1.5 pounds. If you're losing more than that, you're losing muscle. And that's something we have to watch very closely. I mean, and I know that there's other places that, I've had patients that come in and they're absolutely skin and bones. And they're I lost 60 pounds in 2 months. I'm first of all, it was all your muscle. It's all your facial fat. It's all, and the chance that you're going to gain it back. I agree with you. Kennedy, it's about the long game. It's about, if you want to lose 20 pounds, let's plan on 20 weeks. Let's do it slow and steady. Let's watch your nutrition. Let's make sure you're doing everything you need, because on the end of that, you're going to be successful. This person who loses 30 pounds or 60 pounds in 2 months or whatever it was, that person is not going to be successful. That's the person that's going to go off and gain it all back. Right back.
If there's one piece of advice that you could give to women who are listening about aging, self-confidence, what would it be?
That it's okay to invest in yourself, and that it's okay to feel how you feel. It's okay to I don't want to say not like something about yourself, but it's okay to look in the mirror and think, I want to do something about that. We can all be assertive with ourselves, and also not letting anyone else sort of skew that. Don't let someone else tell you how you feel about yourself.
Yes. I love that. That's awesome. Perfect. We also have something exciting that you're willing to offer our audience members. Can you share that?
Yes. So if you want to come in, please make sure you mention this podcast. But we do a $199 new patient Botox special. It's 30 units for $199. It's a really great place to start if you're interested in that. And then BBL, broadband light, is one of my favorite laser treatments for most patients, with the exception of melasma. So if you come in with melasma, we have to talk about that. But BBL stands for broadband light. It's a light-based therapy. There's a great study from Stanford University where they did 2 to 4 treatments on patients a year for 10 years. And at the end of 10 years, people looked younger than when they started. It's extremely natural. It's absolutely wonderful. It takes care of brown spots, takes care of redness. It's a powerhouse anti-aging tool. It's high intensity red light. As a new patient, if you mention this podcast, you can have one for $350 instead of $500. So
that's amazing. Thank you for doing that. That's
you are welcome.
Incredible. Appreciate it.
Thank you for coming on the podcast today. Everything. It was so informative and so helpful. So thank
you so much for having me. And I'd love to come back sometime.
Yeah, awesome. Thank you so much, Brittany.
Thank you, guys.
Today's conversation is a good reminder that wellness isn't just about what we eat, how we move, or what supplements we take. It's also about how we feel in our own skin. Whether your journey includes aesthetic treatments or not, the greater message is that you know it's okay to care for yourself. It's okay to invest in yourself, and it's okay to make sure that you feel like the best version of yourself at every stage of life. Thank you so much for tuning in today. Please make sure to leave us a 5-star review on whatever platform you listen to your podcasts. Follow us on Instagram @Threads of Wealth, and we will see you next time.